Most people think going for more tests means being safer after 70. That the more you check, the more you protect yourself. But in many cases, it does the exact opposite. Before you agree to any medical test, stop. Because the real danger might not be the disease, but what comes after the result. Let me paint you a picture. You're 74 years old. You feel good. You're sleeping well. Your energy is steady, and you're still doing the things you enjoy. Life isn't perfect, but it's stable. Predictable. Yours. You go in for a routine checkup. Nothing urgent, just something you've done for years. Your doctor looks at your chart and says, "Everything looks fine, but let's run a few extra tests, just to be safe." It sounds responsible, careful, even reassuring. So you say yes. A few weeks later, you get a call. There's something we need to look at more closely. That one sentence changes everything. Now you're going in for more scans, then a specialist, then maybe a biopsy, then a procedure. And suddenly, the life you were quietly enjoying starts to revolve around appointments, medications, side effects, and decisions you never expected to make. Not because you felt sick, but because something was found. And here's what nobody tells you. After the age of 70, the math changes. The balance between benefit and risk quietly shifts in a way most people never hear about in a 1-5-minute appointment. Tests that once protected you can now expose you to a chain of events your body is no longer equipped to handle the same way. I've seen this happen more times than I can count. My name is Dr. Ethan Parker. I've spent years studying medical research and watching what actually happens to patients in real clinical settings. And I can tell you this with complete honesty. Some of the biggest health risks for older adults don't come from missed diagnoses. They come from what happens after something small is found, and the system takes over. If you've ever felt unsure at a doctor's appointment, type 1 in the comments, because what I'm about to share could protect you from decisions you can't undo. On this channel, my mission is simple: to help you understand what the research really says about your health after 60, in plain, practical language, so you can make decisions that protect not just your lifespan, but your quality of life. Today, I'm going to walk you through 5 common medical checkups that, after 70, may do more harm than good in certain situations. Stay with me, because number 3 shocks most people the first time they hear it. And number 5 is the one almost nobody sees coming until it's too late. Let's get into it. Before we get into the 5 checkups, I need to give you one simple framework. I call it the longevity lens. Because the way we think about medical testing at 50 cannot be the same way we think about it at 70, 75, or 80. At 50, screening often makes perfect sense. You find a problem early, you treat it early, and you may gain decades of healthier life. The risk is usually lower. The recovery is usually stronger. The benefit has time to grow. But after 70, the equation changes. First, some conditions found by routine testing may never actually hurt you. They may grow slowly, stay silent, and never affect your life. But once they appear on a report, the medical system often feels pressure to act. Second, your body no longer tolerates intervention the same way. A procedure that a younger person recovers from in 2 weeks may take an older adult months to recover from, and sometimes they never return to the same level of independence. Third, there is the cascade effect. One small abnormal result leads to another scan. That scan leads to a biopsy. The biopsy leads to surgery. Surgery leads to complications. And suddenly, a person who walked into the clinic feeling well is now living as a patient. That is the longevity lens. It does not mean you refuse every test. It means you ask whether the test is truly likely to help you live better. Keep this in mind, because everything I'm about to say will make more sense. Okay, let's get into it. Checkup number 1, colonoscopy after 75. Sounds routine, but after 75, it's not the same test anymore. Let me tell you about Dorothy. She was 77, active, independent, no symptom. She'd already had 2 colonoscopies earlier in life, both completely normal. No polyps.
No family history. Nothing concerning. But during a routine visit, her doctor suggested another one. Just to be safe, Dorothy hesitated. Something didn't feel necessary. But she didn't want to seem difficult, so she agreed. The night before the procedure, she went through the standard preparation. The strong laxative solution meant to clear the bowels. By morning, she was weak, dizzy, confused. Her daughter rushed her to the hospital. Dorothy never even made it to the colonoscopy. She was severely dehydrated. Her electrolytes had dropped to dangerous levels. Her heart rhythm was unstable. She spent 4 days hospitalized recovering from a test she didn't even complete. And here's the part that matters. For adults over 75 at average risk, the United States Preventive Services Task Force does not recommend routine colonoscopy screening. Why? Because the risks begin to outweigh the benefits. As we age, the body becomes more sensitive to fluid shifts. The kidneys don't compensate as well. Electrolyte imbalances happen faster and hit harder. And the procedure itself carries risks. A perforation, a tear in the colon, can occur in about 1 in 500 cases. In a younger person, that's serious but manageable. In someone in their late 70s, it can mean emergency surgery, a colostomy bag, and a permanent change in quality of life. Meanwhile, many colon cancers found at this age grow so slowly, they would never have caused harm. So what should you do instead? If you have no symptoms, ask about non-invasive stool-based tests like IFIT. And if you do have warning signs, blood in the stool, unexplained changes, then yes, that changes the equation. But for routine screening after 75, this is a conversation, not an automatic yes. Now, let's move to number 2. This is where good intentions quietly turn into harm. We're talking about aggressive PSA testing and routine mammography in low-risk older adults. Let's be very clear, cancer screening has saved lives, but after 70, something called overdiagnosis becomes a serious issue. Here's what that means in simple terms. We now have imaging technology so sensitive, it can find cancers that would never hurt you. Tiny, slow-growing, biologically inactive. You would live your entire life with them and never know. But the moment they are found, they become something that must be treated, and that leads to overtreatment. Let me give you an example. Richard was 79, still active, still enjoying his weekends, no symptoms. A routine PSA test came back slightly elevated. That led to a biopsy. The biopsy found a low-grade prostate cancer. His doctor recommended radiation. Richard trusted the system. He went through with it. Within a year, he was dealing with chronic fatigue, urinary problems, a significant drop in quality of life. And here's the hard truth. Many cancers detected in adults over 70, documented in major studies like those published in the New England Journal of Medicine, are clinically insignificant, meaning treating them does not extend life, it only adds side effects. So what should you do? Ask one simple but powerful question. If we find something, what happens next? Because that question shifts the focus from detection to outcome. And often, it changes the entire recommendation. Now checkup number 3. This one sounds responsible, but can backfire. Routine cardiac stress testing in people without symptoms. It seems logical. You're getting older. Check the heart. Be proactive. But here's the problem. These tests can have false positive rates approaching 40% in certain groups. That means almost half the time. The test suggests a problem when there isn't one. But once that problem appears, the system moves forward. Stress test leads to cardiac catheterization. A catheter is threaded into your blood vessels and up into your heart. That can lead to finding a partial blockage, which is actually very common with aging. And that often leads to a stent. Now you're on blood thinners. You're managing risks. You're in the system. But here's what most people don't realize. Major trials, including the ischemia trial, showed that in stable patients, stents did not reduce heart attacks or extend life compared to medication and lifestyle changes. Let that sink in. You went from feeling completely fine to undergoing procedures, taking lifelong medication, and face complications without a clear benefit. So what should you do instead? Focus on what actually moves the needle. Blood pressure control, cholesterol management, daily movement, sleep. Because for most people without symptoms, that's where the real protection is. And this is where the longevity lens becomes real. Not everything that can be found needs to be found. And not everything that is found needs to be fixed.
Now, let's move to checkup number 4. This is where the system skips a critical step. We're talking about bone density scans, DEXA scans, and what often happens immediately after. Here's the pattern. You get a scan. It shows some bone loss. And almost automatically, you're prescribed medication. No pause. No deeper discussion. No full picture. But after 70, that automatic pipeline deserves a second look. Because while these medications like bisphosphonates can be helpful in certain high-risk patients, they are not risk-free. Long-term use has been linked to something called atypical femoral fractures. That means the thigh bone, the strongest bone in your body, can actually weaken in unusual ways and fracture with minimal trauma. There's also a rare but serious condition called osteonecrosis of the jaw. Bone tissue in the jaw begins to break down. It's painful, difficult to treat, and it can significantly affect quality of life. Now, I want to be very clear. Bone loss is real. Fractures in older adults can be devastating. But here's the insight most people never hear. The most effective way to prevent fractures is not medication. It's preventing the fall in the first place. And this is where the conversation should start, but often doesn't. Studies have shown that balance-focused movement, especially something like Tai Chi, can reduce fall risk by nearly 50%. That's not a small effect. That's massive. And it comes with zero side effects. So instead of jumping straight to medication, ask a different question. What is actually putting me at risk of falling? Is it balance? Is it vision? Is it medications causing dizziness? Is it hazards in the home? Because the real-world solutions are often simple. Balance training, strength exercises, clearing clutter and tripping hazards, installing grab bars, checking your vision regularly, making sure you're getting enough protein and vitamin D. For some people, medication is absolutely appropriate. But for many, especially those who are active, independent, and have never had a fracture, this should be a thoughtful conversation, not an automatic prescription. Now, checkup number 5. Almost nobody talks about this, but they should. Carotid artery ultrasound in people without symptoms. On the surface, it sounds like a smart idea. Check the arteries in your neck. If there's a blockage, fix it. Reduce your risk of stroke. Logical, right? But here's where that logic breaks down. The procedure used to fix a blockage, called a carotid endarterectomy, carries a real risk. About 2 to 3% of patients can experience a stroke during or shortly after the surgery. In older adults, that risk can be even higher. And here's the key point. Many people over 70 have some degree of narrowing in these arteries. But in most cases, it's stable, silent, not causing any problems. These are what we might call harmless findings. But once they're discovered, they often lead to intervention. And that intervention can actually trigger the very event you were trying to prevent. A small piece of plaque can break loose during surgery, travel to the brain, and cause a stroke. That's not theoretical, it's documented. This is why the United States Preventive Services Task Force recommends against routine carotid screening in people without symptoms. So what should you do instead? Focus on what actually reduces stroke risk. Control your blood pressure, the single biggest factor. Manage blood sugar. Address atrial fibrillation if present. Stay physically active. Because preventing the cause is far safer than chasing a finding. Now, I want to give you something practical. Because information without action doesn't protect you. This is the framework I want you to take into every doctor's appointment. 5 questions. Simple, direct, powerful. Question 1. What is the false positive rate of this test in people my age? Because you need to know how often this test leads to unnecessary follow-ups. Question 2. If this test finds something, what are the realistic treatment options for someone like me? Not in general. For you. Question 3. What are the risks of those treatments? Every procedure has a cost. You deserve to hear it clearly. Question 4. Is monitoring this an option instead of immediate treatment? Because in many cases, watchful waiting is not only safer, it's better. And question 5. What is the most effective non-invasive alternative? Because very often, lifestyle and medical management outperform procedures with far less risk. And here's the shift that matters. These questions change your role. From a passive patient to an informed decision maker. You're no longer just agreeing to what's suggested. You're understanding it, evaluating it, choosing what aligns with your life. And that is where real protection begins. So let's bring this together. After the age of 70, the goal of your healthcare should not be to find as many things as possible. It should be to protect what actually matters. Your independence, your energy, your ability to wake up and live your life on your terms. Because here's the truth, most people only realize too late. Not every condition needs to be found. Not every finding needs to be treated. And not every treatment makes your life better. Sometimes, doing more creates more problems than it solves. And this is where a quiet but powerful shift happens. Doing less often requires more wisdom. It takes experience to recognize when a test is helpful and when it's simply opening a door you may not need to walk through. It takes courage to say, let's wait. To ask, will this actually help me live better? To pause, instead of automatically saying yes. Because prevention is consistently easier than treatment, not just preventing disease, but preventing unnecessary intervention. And I want you to hear this clearly. You are not powerless in a medical setting. You have the right to ask questions. You have the right to understand the risks. You have the right to say no. You have the right to make decisions based on your life, not just a checklist. The best healthcare decisions are not made by default. They are made with clarity, with intention, with a full understanding of what comes next. So the next time a test is suggested, don't rush. Pause. Ask the 5 questions. And make sure that what you're agreeing to is truly aligned with the life you want to protect. If this video gave you a new way to think about your health after 70, make sure to subscribe. I share videos like this every week, practical, evidence-based, and designed to help you stay in control of your health in the years that matter most. And I'd really like to hear from you. Have you ever had a routine test that led somewhere you didn't expect? Leave your experience in the comments, because your story might help someone else make a better decision at the right time. Take care of yourself. I'll see you in the next one.